Here is better than all the water, and she played softball.
Apparently, like in the next couple of months.
It's busy. Close. You have to. So close
Cross-reference the address.
And what's their age range?
This is 6, oldest is 20. So the two are 86, one is doing arts, one is doing
Yeah.
It's nice to still have some girls.
It
is hard sometimes when they get older, so hard.
Yeah, well, especially like now,
So the younger ones like really savor it.
yes,
really trying to.
oh yeah. So I would have to take a train.
Okay, so we'll get started. Thank you to everyone joining online and in person for the second session of this year's WHRI Summer Scholar Series. We begin by acknowledging that the WHRI operates on the traditional, ancestral, and unceded territory of the Coast Salish peoples, the Musqueam, Squamish, and Tsleil-Waututh nations. Further, this acknowledgement, gratitude, and respect extends to all the Indigenous communities on whose traditional territories the WHRI builds relationships. 2026 marks our fourth annual Summer Scholar Series event, and this year's theme is Building Bridges in Research, Embracing Interdisciplinary Collaboration, and Expanding Your Network. We are pleased to welcome Dr. Brittany Bingham. Dr. Bingham is a proud member of the Sechelt Nation and holds an MPH and PhD in Health Sciences from Simon Fraser University. Brittany is an assistant professor in the Division of Social Medicine and the Faculty of Medicine at UBC and a Health Research BC Scholar. Brittany is the lead and founder of the Indigenous Equity Lab, where her work, grounded in matriarchal wisdom, focuses on Indigenous women's health, gender equity, climate justice, and system transformation. Brittany leads Indigenous community-driven health research with the primary aim of improving Indigenous experiences in healthcare and informing system transformation. She's worked in various capacities in research with Indigenous communities for 20 years and is passionate about community-driven research, health equity in women's health, implementation science, planetary health, sexual and reproductive health, learning health systems, and cultural safety and humility. Most recently, her project Impact received 5-year funding to explore and elevate the understanding of Indigenous women's experiences of menopause and midlife wellness. So before we begin, a few technical notes for those in person. Press a button on your microphone during the Q&A. For online attendees, you can submit your questions via the chat. We also invite you for the third session this summer on July 29th with Dr. Kalisha Clausen. And registration for these events is available through Eventbrite, accessible via our website and social media. And concluding this event series, we'll be circulating an evaluation form in August and would appreciate your feedback. Please join me in welcoming Dr. Brittany Bingham.
Thank you so much, Paul. And good afternoon to everyone here and everyone who's joining us virtually. So I just want to introduce myself a little bit more. I like to situate myself with the roles that I play in my family and community. So as Paul mentioned, I'm a proud member of the Sechelt Nation on the Sunshine Coast of BC. I'm of mixed ancestry with European and Norwegian ancestry on my mom's side, and also some Indigenous ancestry from Winnipeg, Manitoba, from the Black River First Nation. But first and foremost, I'm a mom, a wife, a friend, a sister, and a daughter, and many other important roles that I play in my life. So very happy to introduce the Indigenous Equity Lab. This is our beautiful logo created by Margaret August, who's a Two-Spirit Coast Salish artist, also from the Sechelt Nation. And this image is showing this beautiful image of the Coast Salish moon and really grounds our work at the lab. So we're very proud to host the lab and all of our work as guests on the unceded homelands of Musqueam, Squamish, and Tsleil-Waututh peoples. And really grateful for the support and of these nations in our work, but also we want to always support and uplift their inherent rights to these lands. And the Indigenous Equity Lab is a program of research that is dedicated to advancing Indigenous health equity. Our mission is to support gender health equity, women's health, revitalizing traditional wellness practices, but also very much so to support Indigenous capacity building and mentorship. You can see here our small but mighty team, but this team has really been created and grown over the past year, so very quickly. But we have PhD students, master's students, practicum students, and research coordinators currently in the lab, and are seeking to grow in lab members over this next year as well. So this is a photo of my great-great-grandmother, Agnes Charlie, from the Sechelt Nation. And I was gifted this photo several years ago and took inspiration from this photo for the creation of the Indigenous Equity Lab to ground our work in matriarchal wisdom. So I took this sort of central basket pattern and used this pattern to create this model of what our different baskets of work would be. So on the left side, really grounding our work in traditional knowledge and wisdom. And we have our 4 baskets of work: gender equity, women's health, climate justice, and system transformation. And through all of that, always focusing on capacity building in this next generation of Indigenous scholarship. So talking about, I was asked to speak today a little bit about interdisciplinary research and building partnerships, which is a huge aspect of Indigenous health research. However, when thinking about this presentation, I was thinking about how often in the Indigenous health space, we don't really think of it as interdisciplinary because those sorts of frameworks are really how we're trained in a Western system of science and in Western systems of education. And so as I introduced myself in the beginning as a member of community and the work that I do, it's not really seen as much as being inside a certain discipline per se. And so I just want to talk a little bit about some of the Western limitations of our research systems that often create these silos where we're studying in isolation sometimes within those disciplines. And the challenges that we face as researchers and health researchers are actually really deeply interconnected. The health inequities, gender inequities, climate change. Folks are often a bit surprised that one of our baskets of work is climate, which I'll talk a little bit about at the end. But when you think about the health and wellness of First Nations communities and community members, if you don't have healthy land and territories to live on, to breathe fresh air, to drink clean water, it's incredibly interconnected with your health and wellness. And so pushing back a bit against these, Western institutions of knowledge systems, which are often siloing us into disciplines. And these communities live in intersectionality every day and face complex challenges that always require interdisciplinary solutions. So I'm going to talk a little bit about Indigenous research methods and relational research, and then highlight some examples from the Indigenous Equity Lab work. So relationship is foundation, of course, to Indigenous research and all the work that we do. Relationship to land and waters, community, families, and future generations. And so these relationships last long after funding cycles and long after grant cycles end. But these strong relationships are required for strong research. So I'm always coming back to this book. So if you haven't read this book already, it's really has been foundational to my training. And I read it many years ago, and I always pick it back up and read it again often. But this was really, I don't want to say that Sean Wilson was the first person to bring forward this idea of research being ceremony, but it was the first time that I processed it in any real way in my training. Just to think about how when we're doing research as Indigenous scholars, we are accountable to all of our relations. So it is personal. You know, we're often talking to participants, communities, families, knowledge holders who are deeply connected to us in our work and personal lives. And so he really talks about this in a beautiful way, and how these methods that we use are an aspect of ceremony and witnessing people's stories, and enacting our obligation as researchers to share those stories in a good way. So this is another framework that we're using to ground our work in the Indigenous Equity Lab. So the Indigenous Gender-Based Analysis Plus framework, created by Chastity Davis and Dr. Natalie Clark, is a really incredible document that has a number of different guiding principles and dimensions that we found very useful in our work. So IGBA Plus really recognizes that colonization has imposed systems of governance and family structures, and that this has contributed deeply to the ongoing marginalization of Indigenous women, girls, Two-Spirit, and gender diverse peoples. And it requires us to look deeply and confront some of these historical and ongoing realities. And the IGBA Plus toolkit invites us and every person to learn from this history and current reality, and implement this in their work and lives. So we often draw upon this as a key framework in our work. And we think about it as it's created a bit of a nutrient-rich soil for us to do this work in a good way. One key piece of it that I want to draw your attention to is the 7 R's, which resonates greatly with me. So the remembering, rematriation, reclamation, respect, relationship, recognizing resistance, and relinquishing power. And so this is often highlighting that the wisdom that we need to do this work has always been there. We're just going through a process as Indigenous people and scholars to look back to what we've already known for many generations. You may have heard the concept of two-eyed seeing, which is a more common concept. This is brought forward by Elder Merdina and Albert Marshall, Mi'kmaq elders, and recognizes that Western knowledge systems have unique strengths that we need to draw upon, but also that those are distinct from Indigenous knowledge systems. And this idea that we can bring together these two viewpoints, or see with the two different eyes, grounding ourselves in humility and reciprocity, and the understanding that not one single worldview holds all the answers. So I think about this when thinking about this interdisciplinary collaboration in research often. So in my projects, I'm often trying to bring in people who have diverse worldviews, diverse skill sets, and we think about it as that each person with their training is bringing their unique skills and gifts to the research for the betterment of the research. So building strong partnerships. I want to just speak to one of the key lab partnerships that we have. So my lab is partnered with the Unlearning and Undoing White Supremacy and Indigenous Specific Racism Lab. So the UNU lab, which is located at BC CDC and led by Dr. Danielle Bain-Smith and Dr. Kate Youngblood. So this partnership is super important to us, just to distinguish between different aspects of the work. So I was gifted some of these slides by their team, which I've included the citation below for their article that describes this in more detail. But they use the copper pot and basket as a key metaphor for this work in Indigenous health. The copper pot symbolizes the work of settlers, including settler leaders in mainstream healthcare systems. And this is really the work of dismantling oppression, examining systems of white supremacy and racism and settler colonialism that continue to uphold different barriers and marginalization for Indigenous people in our healthcare system. And so the copper pot work must be undertaken with advice and leadership by First Nations people, but this isn't the work of First Nations people. And so making that distinguishment is very important in this space. And I'll talk a little bit more about why. So the basket work, which is the work that we really think of ourselves as doing in the Indigenous Equity Lab, is the work that's directly with First Nations, Inuit, and Métis peoples, that's drawing upon their wisdom and distinct knowledges. This is the work that's always been there, is deliberately and systematically undermined through settler colonial systems. And this is represented with a birch basket, which is from the Dene people of Treaty 8 territory. And so this model or metaphor was really developed by Danielle and Kate when talking about their diverse worldviews and their different training and knowledge systems and where they come from, and trying to figure out whose work is whose work. And so they often ask what work and whose work, so that we can understand this deeply interconnected world of addressing Indigenous specific racism, but also doing our work in truth and reconciliation in healthcare. So interdisciplinary research in action. I want to just talk about different projects that we have in the lab and the foundations of the relationships for those projects, our community priorities, our interdisciplinary collaboration, but also how we're pulling in different Indigenous methodologies in order to influence clinical care and experiences for Indigenous patients. So I'll just go back. So this is called the Ocean Project, and this is a shared project between myself and Dr. Jillian Hanley, standing for Ovarian Cancer Equity, Access, and Navigation. And so the first objective of the study is to understand the uptake of opportunistic self-injectomy in rural remote healthcare regions. And then our project is taking on objective number 2, where we're going to develop tools to help clinicians have culturally safe conversations about opportunistic self-injectomy with their Indigenous patients. And this is drawing upon the deep history of systemic violence against Indigenous women in reproductive healthcare settings, and figuring out how we can start leaning into that complexity with providers and ensuring that Indigenous women aren't left out of ovarian cancer prevention simply because these conversations are so difficult. So we're using a strengths-based and reproductive justice approach where we're centering Indigenous women's leadership and well-being. We're drawing upon that two-eyed seeing framework where we're bringing in all different experts from different disciplines. Again, that gender-based analysis framework, OCAP, and we've created an Indigenous guiding group, which is comprised of a number of different disciplines and leaders in this space. And they'll be really helping lead us through the whole project from beginning to end. So the guiding group is grounded in Indigenous rights and sovereignty, matriarchs, knowledge holders, and community priorities, and also people of lived experience. So there's members of the guiding group who, through their personal connections, being from Indigenous communities in BC and beyond, have experienced different types of violence in reproductive healthcare in their families as well that they bring to the conversation. So we're really designing this to reflect the realities of not just rural and remote, but underserved Indigenous communities, and hopefully prevent further harm through the products that we're able to come up with. So reimagining this type of cancer prevention just means that, we're working hard to have Indigenous leaders being the ones to shape this system going forward as best we can, supporting pathways to equitable and trauma-informed ovarian cancer prevention. And as I mentioned, the guiding group is made up of health researchers, community members, family medicine docs, Indigenous OB-GYNs, which there's very few of those, but we have several involved, midwifery, doulas, as well as cancer researchers. So one underpinning for all of our research at the Indigenous Equity Lab is that safety starts with us. So we spend a considerable amount of time as well internally with our team and with our research teams when we bring together two-eyed seeing or multidisciplinary research teams to take the time to create safety and deep relational bonds with the team. And what I've found and observed in community research is that when you go into a community space and you don't have safety within your core team, that can be felt on the community level or with participants. So spending that intentional time to build those relations internally is really important. And thinking about how system change and transformation, institutional change often begins with ourselves and the work that we do. And so institutional change also begins through individual accountability and contributions as well. So community-led and interconnected health research. Another project I want to talk about is the Impact Project, investing in matriarchal power access, care, and traditional wellness. So this project is grounded in the fact that menopause is such a critical and overlooked phase of women's health. And for Indigenous women, this cultural transition may be seen differently than in Western contexts. So this transition to a matriarchal or elder role carries very special social, spiritual, and community significance. And often research has not looked into this. And so we're looking at the intersection of gender inequity, Indigenous-specific racism in healthcare systems, as well as data exclusion, which has created a profound gap in menopause care for Indigenous women. So this project has been funded for 5 years, but we're currently in the first phase of research where we're doing community engagement sessions and just really hearing and grounding this work in Indigenous women's voices. So we first set out to meet with knowledge keeper Cease Weiss, who's from the Squamish Nation, and had a beautiful conversation with Cease in her garden, which is based at Stanley Park. And Cease is an ethnobotanist and studies plants and their traditional uses. And so what Cease shared with us as a team really stuck with us. She shared that during this pivotal time of menopause, we need to care for ourselves just as we care for children. We need to be gentle with ourselves. We need to be loving to ourselves. She talked about the yarrow plant as an umbrella plant to matriarchal wellness, and that actually love is needed most in a women's health journey. So we're drawing upon these traditional matriarchal teachings when we build the wisdom circle that will guide the impact work as well. So far, we've had engagement with Musqueam, Stalo, through the Tulalip Out, Stalo Women's Group, the Seashell Nation, Niskatchamick Society, and Squamish Nation, and have actually had quite a few other communities reach out to us because they've heard of these gatherings and want to participate. So communities have stated there's a critical need to understand women's unique menopausal experiences, including access to care and service needs, et cetera. And we haven't even quite begun to reach out to more rural and remote communities who I believe will have different experiences when accessing complex menopause care. So as I mentioned, this community-based research really begins and is grounded in these relationships that are long-term partnerships, having the communities define the priorities, and having matriarchs, elders, and knowledge holders guide the research through defining what our research questions are, our interpretation, and how we mobilize knowledge following data collection. So this interconnected research, which we could call interdisciplinary as well, is creating the type of solutions that are more relevant and sustainable, and I believe capable of transforming healthcare systems because they're really reflective of what communities are experiencing on the day-to-day. So also, as I mentioned, that our health cannot be separated from the health of the lands and waters in these territories. And so it's well known that since time immemorial, Indigenous people have sustained health and wellness through relational systems of care that are deeply rooted in relationships to land, water, food, systems and ceremony, and intergenerational knowledge transmission. So climate change is inherently gendered with disproportionate impacts on Indigenous women, Two-Spirit, Indigiqueer, and gender diverse peoples. And Indigenous knowledge systems offer critical guidance for how we're going to move forward and respond to the different climate-related impacts that we're seeing now. So I want to bring this forward as this is another framework that we draw upon. So I'm very grateful to have been able to collaborate with Dr. Nicole Redvers. If you haven't read her work, I greatly recommend reading her work. She's an incredible Indigenous scholar doing global work in planetary health and climate led by Indigenous people. So this is her framework that she's published on the determinants of planetary health and an Indigenous perspective, and just talks about how human health and environmental health are inseparable, and that Indigenous governance strengthens ecological stewardship, and that climate action work is health equity work. And this is work that needs to be done so that future generations can also not have to deal with the same health equity issues that we're seeing today. So Indigenous leadership is really something that we're seeing on a global scale that is at the forefront of climate justice and looking at health equity and climate and that intersection. And these interdisciplinary partnerships on the global scale and the local scale are what's moving knowledge to practice for system transformation. So climate action, as one of our baskets of work and research at the Equity Lab, is really essential as an investment in health and well-being of those future generations that come after us. So relational research is something that or interdisciplinary research is something that creates these pathways towards healthier communities as well as healthier futures. So we at the lab want to reimagine research as a collective process, as something that's inherently relational to transform systems and care for future generations. And the research requires, at its core, collective and interdisciplinary leadership. The relationships we create will shape these future systems for our future generations, and seek more justice where we need to seek justice as well. Thank you. Any questions?
Interested to learn more about how
Yeah, so a few different ways that it can be done. So creating safety through that trauma-informed lens and grounding in Indigenous knowledge is happening with the mentorship relationships within the team, like among the Indigenous staff. And part of that has to do with breaking down some academic competition frameworks that exist. So some of these systems that we're operating in, the goal is for us to compete against each other. Often universities create that environment, compete for funding, compete for opportunities, compete for whatever, that's the whole nature and foundation of the whole system. And so we're really trying to move against that through creating amongst our team just a space of sharing, a space of uplifting, and really trying to have those conversations head on. As far as the two-eyed seeing research teams, where we have non-Indigenous scholars working with Indigenous scholars. We have developed some training tools. So I do have like a self-directed learning guide that goes sometimes to scholars who have not much experience with Indigenous health research. And that's to get people up to a real baseline understanding so that the labor isn't on the Indigenous scholars in the group to just teach and educate the non-Indigenous scholars on, all of the foundational agreements, foundational documents, and rights frameworks. So we have that as a way, and then have open conversations as a research team of, how can we reflect on that? How does that impact our work? And trying to just sit in circle together and have open dialogue and create a lot of opportunities for that before we even set foot in community. And often, if we're doing really community embedded work, sometimes that isn't the space that the non-Indigenous scholars are offering their gifts to, right? Like if we're doing working with a very vulnerable community, sometimes it makes more sense just for the Indigenous scholars to actually go and do the community work. And sometimes the non-Indigenous scholars are contributing in other ways. So yeah, just really trying to build that foundation in a number of different spaces, but it sometimes requires stepping outside of those traditional academic frameworks and finding other ways to connect. Any other questions? Yeah.
I'm still kind of thinking through what I want to ask. So bear with me. I'm really curious about like the relational aspects of like the pot and the basket and the two-eyed seeing, given that like in terms of labor, there's differences, there's distinctions on both ends. And like with two-eyed seeing, I remember I was at a conference, I think last year, and someone was remarking that it's like one of the eyes is so much bigger, And so there's this like disproportionality that happens. And oftentimes it's on the like Indigenous researchers or the Indigenous like team members to like educate the settler team members. And so there's like, yeah, I'm just curious about like how to navigate that relationally and also how to report on that in ways that acknowledge those dynamics that are inherent within like the context that we're forming these relationships within and like the systems that we're reporting out through and such.
Yeah. I think that's a really important point because even if we think about the frameworks in which scholars and faculty members are measured at the university and tenure level, I mean, I don't want to get into a whole tangent of that, but there is a lot of that education that comes along with working on interdisciplinary teams where often the labor does fall upon the Indigenous scholar to kind of bring people along or do some teaching or do some educating in those spaces. And like, where is that captured within a job description? And it often isn't. And so that's the piece that, I think this copper pot and basket work is so important because I worked in the space for many years before we had copper pot and basket and the language to be able to explain like whose role is what role. And what I would observe is that I often called it the sprinkle approach. So I had a slide that would show a bag of baking sprinkles. And I would say like, well, we're trying to indigenize a healthcare space, but we're just going to build the healthcare space and then we're going to sprinkle one Indigenous person on top and just see like within that system, can you just fix it? Right. And so that happens a lot and we see it happening a lot. And what we can observe is that it doesn't last very long. And so either the person doesn't last that long or not much change can happen. And it's understandable when it's just, one sprinkle in this big, wide environment of so many different moving parts and complexities. And so that's why I think the copper pot and basket work is so important, because what we're doing and the conversations I've had with UNU Lab is that we need our systems of research and health care to be safe so that we can do the basket work. So the basket work can't happen if we don't have people who are having those conversations about anti-Indigenous racism, who are doing some of the educating, doing some of the teaching, so that, for example, our lab can actually just spend time in community and we can actually just work with patients and we can do the work that impacts community. And we're not at the same time trying to have those leadership conversations all the time to try and fix systems, essentially. And that's at the very, very early stage of them sort of implementing that framework. But I've been lucky enough to be witness to a number of events that they've hosted where public health leaders are really leading the charge and as far as copper pot work. And so they're not only coming to the table because they've done so much work with people, that they're coming to the table with advanced knowledge now of anti-Indigenous racism and how to change and transform systems. And they're kind of meeting in the middle with the Indigenous leaders and scholars, and then we can like move forward together once they're at that same space of understanding. And so it's really pivotal work that's happening. And I think that partnership is so important for us in the lab because we're sort of involved in their work and we have regular meetings with UNU and see the work that they're doing. And it completely supports the work that we're doing as well. So then when we reach out or someone reaches out to us on a research partnership who's already been engaged with UNU, they're at such an advanced understanding. And it just really takes a lot of the labor and pressure off us, and we can just kind of hit the ground running and start doing the research. Any other questions? Yeah.
I think I have a question. So you're talking about your team and how like Indigenous and not Indigenous scholars work together, but it's for your specific kind of lab when you have those people. But would it make sense in a general researchers in Canada learn it when they become researchers before they get into your lab?
For scholars to learn?
Yeah, like non-Indigenous scholars, because like scholars or researchers that work with you, yeah, they work in specific environments where you have those teaching tools and develop resources for them. But 99.9% of scholars that not Indigenous will not know it. Like I know, for example, at UBC, like if you want to do for Faculty of Medicine now, they said, oh, you should have like 3 specific courses as prerequisites, but probably those courses are like very general courses for history or relationship, but those courses don't give the perspectives that you given in your labs. So I think like it's maybe not a question. I think unless you change in the researcher's mind to work in the way you work in general, like, yeah, Western tools are important, but I think in Canada, if you incorporate all those tools at once, would our research like by default will be much better and more inclusive?
Mm-hmm. Yeah, I mean, I think for having people come in with already that level of knowledge and skill set and teaching that earlier is essential. And I think for those of us with younger children, I think we see that, right? That's happening. I often talk to some of the younger colleagues of mine about how the TRC, the Truth and Reconciliation Commission, only actually happened in 2015. And that's not very long ago. I worked in this field many years before the TRC came in 2015. And there was a distinct shift in this work and this space when that happened. And so prior to that, I often refer to it as our histories and our truths were up for debate. And so people, if we would tell the stories of the inequities, tell the stories of what's been happening in community and really, how healthcare systems have perpetuated violence against Indigenous people, and research has, it was met with a bit of like, oh, really? But was it that bad? Like there was a bit of that kind of response sometimes. And once the TRC came out with thousands and thousands of testimonies and evidence, it was kind of this thing that just gave us freedom to say, no, this is the truth. And then now what are we going to do about it? So we know, so we have to do better. And I think children are learning that earlier, and now it's being built into curriculums, but there's still some catch up to do for sure with teaching.
You know, like I have 3 kids, they already like in the end of university, so they didn't catch. I think my younger one catch it in high school that had several courses that then were not mandatory. But I think the way they teach the school, it's actually moving kind of in opposite direction. I think if the teachers don't know how to teach those subjects, like, or you don't bring indigenous scholars even in high school to teach the subject, it's just another subject. And some of them, I know my son comes and like, oh, why we need to do it? We need to study math and chemistry because we want to go to science at UBC. I think like it's embedded into the curriculum. Like, for example, I'm Jewish. I think from this year or next year, they introducing like a Holocaust studies into the curriculum. But it's again, if it's not done in the correct way, it will be exactly the same output. I don't think like my problem is that all this is teaching and we're trying to incorporate, but my question is if we're teaching kids in the correct way that they actually understand it, that not something they're supposed to learn, but that kind of embedded in the system, not system, but an understanding of where you are in the country or in your society.
Yeah. I mean, I think there's so many different pivotal points where Canadians need to learn it before they get to the point of being a senior scholar in this space, right? So, you know, through undergrad, through grad, through elementary school, or, you know, through their work as a leader in the health system, there's so many tools that are now coming out to support leaders to go on that learning journey at a later point as well and continue on the learning journey. Like it's not just a kind of one and done type of thing. And so that is a lot of the work that the UNU lab is doing. So they have an unlearning club that they have initiated with, I believe, the Ministry of Health, and then now through BC CDC and other healthcare settings, where they're continuing those conversations and continuing that learning. So it's really important that there's all sorts of resources and places for people to go who want to learn. And I think the copper pot piece is that, you know, having the accountability on non-Indigenous scholars to continue on that learning journey and to keep going, so that when they do reach a point where they want to have a partnership or they want to work together, that they've taken it upon themselves to go deeper in their knowledge.
I was intrigued by like the ocean project. I was wondering if you could please like talk more about it and like how the idea started and just kind of like what like the goal is.
Yeah, for sure. I'll actually just go back. So Ocean was, and of course you all probably know Dr. Gillian Hanley's work well, but I had had many conversations with her and had done some guest lecture presentations about the history of reproductive health care for Indigenous women, and specifically around forced sterilization of Indigenous women and that history, which is very closely tied to our history of residential school and colonialism in this country. And so just sort of how Indigenous motherhood has been treated, how Indigenous women have been stereotyped as not being fit mothers, having too many children, having children too early, the whole host of very harmful and racist stereotypes that exist in these systems for Indigenous women has led to often coercion around sterilization or sterilization against with no consent has happened a lot in Canada. And there is some movement to pass a bill on this nationally, actually. One of our guiding group members has been involved in the testimony of that. And so digging deeper into that history, had many conversations with Gillian around, you know, how do we begin talking about ovarian cancer prevention when the prevention method of salpingectomy is actually could be considered quite invasive for an Indigenous woman. Not only would they likely, in many cases, in many communities, not have access to culturally safe reproductive health care in very small communities, or even in the city sometimes, very difficult. And clinicians as well on the other side may have not many tools, as we're saying, like what are the tools that can teach them about this history. So when they have conversations and counseling with a patient about their ovarian cancer risk and whether or not they want this procedure, that they can come at it and approach it from a really grounded place in their knowledge of the history and why Indigenous women may have difficulty in accessing or having those conversations, or they may avoid it altogether. So what we're really trying to do with this is, we're leaning into the complexity. This is a very complex issue for clinicians, for patients, for communities. And so we're going to have some of these hard conversations about this history, but also where do we go from here? And how do we start building a foundation where Indigenous women aren't left out of ovarian cancer prevention simply because we don't have the tools to have those conversations properly. So some of our guiding group members have personal experience with community members who have had forced sterilization in their communities. And then, of course, having Indigenous OBGYNs who bring their own unique perspective, but also the clinical lens. So we've had great conversations so far, but we're at the very beginning of this project. So I'm excited to see where it'll go. Yeah.
Just opportunistic, that word.
Yeah.
Are people already opting into, because my understanding is like the opportunistic aspect of it is like that they're already having some form of surgery. And like, it's like, once it's like, since you're there already, let's also do this thing. Is that what that is?
Yes. Okay. Or I also believe that women can seek it out if they have, or they can be counseled on it if they have some family risk or other risk factors that might make this a good option for them. But yeah, it will involve really important conversations between the clinician and the patient, and probably some awareness in communities and among women too, to understand that they have this option if they want it.
Awesome. Yeah. It seems like it's going to have like a lot of really transferable insights.
Yeah.
Yeah, it's just related to the opportunistic self-injectomy ocean study, because one of the things that you mentioned, and one of the things that my understanding of it is that the discovery of the cancer-related risk is related to family history. But then what I was wondering is, because this is targeting like rural communities and underserved communities, is there a reporting gap in terms of like identifying people that would be basically good people to talk to the population of people?
Like identifying who's at risk?
Yeah, because like I understand that like accessing the health system has to do with whether someone can be identified as being part of that risk group in the first place.
Yes. Yeah, I mean, I could do a whole other presentation on that. But I would just to touch on briefly on it, like in other presentations I've done, I've called it like an Indigenous data crisis. So because we've been working towards systems of data sovereignty, data governance in this province, we actually, up until a few years ago, haven't even been asking self-ID questions to Indigenous patients as they come in our systems. And so that's only been something that's been happening more recently. And then there's anti-racism issues with who asks it and how they ask it and what is it for. So it's usually first point of contact when you come into an emergency department, for example, that somebody there will ask if they're Indigenous or not, or how they identify. That's only been in the past 5 years that that's even come in as a question. And so if you imagine our data has not caught up to that yet, and most people are choosing not to self-ID because they're afraid of bad treatment after self-ID. So there's a lot of work to be done on the data side. In the work that I've done in community around primary care access and culturally safe care access, what I heard anecdotally was many people in First Nations communities do not get counted as a cancer case because they don't do screening, don't have access, and by the time they go to hospital, they die of cancer. And so that piece too is something important to consider, that there's a whole population of people that we're just not seeing in our numbers because they don't have access, which I think will be talked about in this rural remote context. But yeah, we have a lot of work to do to work towards having really strong data so that we know actually, how many people are dealing with ovarian cancer, or how many people are being screened, and how are they being screened, or how are they getting access to that. So the BC Cancer team, they have an Indigenous cancer team, and they're doing some incredible work in that area already. Yeah.
Brittany, thanks so much for this. Thinking back to your comments about the inherently competitive nature of the traditional Western colonial academic model, are there institutions or faculties, academic departments within institutions anywhere in the world that could stand as a bit of a model for the kind of system transformation you're thinking about?
Yeah, I know that there is some talk in Canada around creating an Indigenous medical school. I don't know, I feel like I've just seen some posts about it. But I think the interesting part for me is when you look at the breadth of inequities that Indigenous people are facing, we could argue that there's enough work for Indigenous scholars to multiply and have full research programs and continue with this work for generations to come to make improvements. And so I'm a firm believer that Indigenous scholars should really never be competing against each other in this space, because we have so much work to do, more than enough work to do. So whether or not how we build those systems, I'm not sure, because we're still in the same kind of tenure requirement space. But I do think there's been some positive movement towards acknowledging community-based and community-driven equity work in the Indigenous space in faculties. But that's at the newer stages now. But a lot of amazing work happens in New Zealand in this space. So many years ago, I went there and toured. They have an Indigenous Maori university, where all the scholars are studying Maori topics and working together collectively. And so that's definitely an inspiration point for us here too. Any other questions? Nope. Do we know if anyone online has any? No. Okay, thank you, everyone.
Been online.